Hi, everyone. My name is Dr. Esiosa Ighodaro, MD, PhD, and today I will be going through question 2 from TrueLearn USMLE Step 1 Test Bank. I am currently a neurology resident PGY4 at Mayo Clinic, and I obtained my MD, PhD degree at the University of Kentucky, where I did my PhD work in neuroanatomy, small vessel disease, and dementia. So I've spent over the last 10 years in neuroscience, neurology training, seeing patients, doing research. So I'm here to help you do well on your USMLE Step 1 exams. So be sure to check out my website listed here that talks about some of the different teaching opportunities that I have related to neuroscience. And also be sure to follow me on my YouTube channel where I post videos regarding neurology teaching, study tips, and I also host study groups. And if you would like to participate in any of these study groups, feel free to reach out to me as well. Today, we're going to be talking about TrueLearn. TrueLearn is a test bank company that provides a lot of products to help you with your different studying needs. They provide USMLE Step 1, Step 2, and neurology shelf exams. And the key to doing well on these board exams and standardized medical exams is practice, practice, practice using a credible evidence-based test bank. And TrueLearn is one of these test banks. So what I'm going to do today is we're actually going to go through a case and I'll kind of talk about testing strategy, the TrueLearn format, and why you should consider purchasing TrueLearn for your USMLE Step 1 studying needs. So with this question, we're going to get started and I'll give you some testing strategies. So when I'm reading through questions, I like to highlight and make things efficient, makes things stick, and then you can learn what are some of the key components that are high yield on the question that will help you answer and get it right. So here we have a 39-year-old woman who comes to the ED because she's having a seizure. So when you hear this question stem, 39-year-old female has a seizure, what are some of the major structures or major risk factors that are leading someone to have seizure in their 30s to 40s? So some of the common causes of seizure in someone her age would include stroke, brain bleed, tumor, or toxic metabolic processes. She does not have any past medical history, and they show an image below of a single brain mass with neurosurgery consultation. She undergoes resection of the tumor, and the biopsy specimen is viewed below under a microscope. And so this is what we see here. So anytime you're looking at an image, you first want to identify what are you looking at? Is this a CT scan, MRI scan, chest X-ray, EKG, or histopathology image? So here, this is a histopathology image, H&E stain, and H&E stain is one of the main, most common stains that are used in pathology that kind of gives you a gross overall anatomy of what the tissue looks like. And it's pretty much non-specific, but you can pick up patterns with an H&E stain. So we see the H&E stain, and then we see these characteristic pathognomonic abnormalities on the H&E stain. So we see these concentric, multiple, discrete, circular regions that have this amorphous material in the center. So you want to memorize what this image is, and it's an image of a pneumoma body, and that is pathognomonic for a specific tumor in the brain, which is meningioma. So even before we look at the question stem, we already know, even before we look at the answer options, we already know the case presentation, the diagnosis, and then once you know, okay, this is meningioma, there are certain things you should know about a meningioma that will probably help you answer the questions below. And this is a testing strategy that I highly recommend when you're taking your exams. Figure out what the diagnosis is before you look at the answer options so that you don't get confused or get trapped into some of the incorrect answers. So now let's look at the answer options. So A talks about her symptoms are being caused by the most common overall brain cancer in adults. That's incorrect, and it'll explain why. And below, the most common overall cause of brain cancer in adults is usually metastatic disease. So answer A is incorrect. And I like to, won't let me do it here, but when I know that the answer is incorrect, I cross it out with the computer. Answer B talks about her symptoms are caused by a brain mass that originates from arachnoid cells. And if you remember from a meningioma is part of the meninges, and the meninges include the different layers, dura mater, pia mater, and they also have the subarachnoid space that is in between the arachnoid matter. So B sounds correct. C, symptoms caused by a brain tumor that is found in this cerebellopontine angle. That is not correct. D, abnormal proliferation of cells that express GFAP or glial fibrillary acidic protein. Again, that makes you think, could this be a piloastrocytoma? And we know, nope, we're looking for options that talk about meningiomas. So D is incorrect. And E, patients with this condition develop symptoms due to compression of the optic chiasm. And one of the questions that they love asking on USMLE STEP exams is optic chiasmal type tumors. Could this be pituitary adenoma or craniopharyngioma? And that's usually what they're getting at with answer E. Again, this is a meningioma that doesn't fit the characteristic of E. So we know that A, C, D, and E are wrong. So we choose A, and A here was the correct option. So really know your histology slides because those are extremely high yield on the neurology section. And one great thing that TrueLearn does is they offer really great high yield, detailed histopathological images so that you can start to match these histology slides with the underlying etiology so that when you see this on your exam, it takes you 20 seconds, read it, you know what the diagnosis is, you go to the question, figure out what's right, and then keep it moving and not waste time. So if you scroll down, TrueLearn talks about meningioma, and then it kind of bolds what's high yield. And they also go into detail about the meningioma, which is pretty interesting as well. And they also talk about imaging. So this here is an MRI scan of the brain that is a coronal section that's highlighting what a meningioma looks like on imaging. So also know this image too, because maybe next time they won't show you a histology slide, they'll show you a brain scan. So know what it looks like on imaging. And then they go through it and they talk about not only why is the right answer right, but they also talk about why the wrong answer is wrong. And here they go through option A, like we mentioned, metastatic disease is the most common. And then option C, they were getting at the cerebellopontine angle tumor, which is a schwannoma. So really know this image. This image here is also H&E, and it's really high yield as well. Option D is getting at the GFAP. So when you think GFAP, you can think astrocytes, parasitic or pilocytic astrocytoma, or GBM, glioblastoma multiforme, which is a malignant brain cancer. And know this image here because it's showing what the GBM looks like underneath a microscope. This is an H&E slide, and you see the little RBCs that are coming in, infiltrating the brain parenchyma. You'll see gliosis, you'll see destruction, you'll see pilocytic tumors, which is what the it's what the black arrow is referring to, is this abnormal clumping of cells surrounded by a border of necrosis, hemorrhage, and microvascular proliferation. And the pituitary adenomas, like I mentioned earlier, when you hear pituitary adenoma, you're thinking something with the optic chiasm or the visual field. So know this chart. They love asking about optic chiasm tumors leading to a bitemporal hemianopsia. And then again, bottom line, because that was a lot of information above, because the main takeaway is meningioma, how to recognize it on histopathology, what does it look like on brain imaging, and how does it present clinically? And again, some people are more of a paragraph readers. I'm more of a visual and chart. So TrueLearn has a beautiful chart that if you know this chart, then you pretty much know everything you need to know for this question and brain tumors for USMLE step 1. So again, here are all the different imaging findings: glioblastoma multiforme, meningioblastoma, meningioma, oligodendroglioma. This is also really high yield. They love this fried egg appearance on imaging, schwannoma, and they also have references as well. So if you have any questions regarding this question, feel free to post on the comment section on the YouTube channel. And again, be sure to follow me on my YouTube channel where I will be discussing more of TrueLearn's test bank questions. And if you haven't done so already, be sure to check out Neuroscience question 1 that I just recently posted. And I look forward to working with you all and helping you all do extremely well on your USMLE step 1 and other USMLE test bank questions, and doing well on the neurology section. Good day, and I'll see you at the next video.